Hi, I'm Dr. Steph Roche, and I'm a GP with a special interest in women's health, particularly menopause. And today we're going to be talking about menopausal hormone therapy. We used to call this hormone replacement therapy, but we're moving away from that terminology because menopause is really not a deficiency state. It's a natural process, part of life. And if having low estrogen was a disease, then being a man would be a disease. So we now call it menopausal hormone therapy. There's so much misinformation out there when it comes to hormone therapy. I'm sure you've heard a lot of scary information about cancer and other risks of hormone therapy. So over the next few videos, we're going to discuss the risks and benefits so that you can make an informed choice. Firstly, who needs menopausal hormone therapy? So many women go through menopause with only a few minor symptoms. They don't really struggle. They can still continue with their lives. Those women don't need menopausal hormone therapy. Hormone therapy is used for women who are struggling with severe hot flushes and night sweats that are interfering with their daily life and sleep, or for the treatment and prevention of osteoporosis, which is fragile bones. So those are the two main groups who can really benefit from menopausal hormone therapy. In these women, so people who are struggling with hot flushes or night sweats, or who have osteoporosis, if they are within 10 years of their final period and they're under the age of 60, the benefits generally outweigh the risks. So hormone therapy is relatively safe in women below 60 within 10 years of their menopause, and we'll go more into detail regarding the risks and benefits in future videos. So how do we give hormone therapy? So the estrogen that we're giving is the one that's doing the work. So the reason that you have hot flushes and night sweats, together known as vasomotor symptoms, is because your estrogen is going up and down and overall going on a downward trend. So we're giving you estrogen so that you feel a little better. We'll start with a low dose, the lowest dose that helps you, and then adjust it as required. So estrogen is the main hormone that we're giving. But normally in a menstrual cycle, your estrogen goes up and then down, and your womb lining is shared as your period, up and down every month during your reproductive years. If we give you estrogen to take continuously, the lining of your womb can overgrow and eventually become cancerous. So when we're giving you the estrogen to treat these conditions, we also add in a progesterone in different forms, which I'll explain. So if you have your uterus or your womb still, you will get estrogen that will help you with your symptoms, plus a progesterone, which will just protect your womb from overgrowth, that lining from overdeveloping and progressing to cancer. So if you have a womb, you will always get estrogen plus a progesterone. If your uterus has been removed, so you have a hysterectomy, for example, if you had very big fibroids and your gynae removed your womb, you only need an estrogen. So that progesterone isn't necessary because that was just to protect your womb lining. So you'll just get an estrogen. So how do you take in this hormone therapy? So there's lots of different options, but the gold standard, which I'll explain in the risks and benefits video as well, is estrogen through your skin because it has the lowest risks in the rest of your body, and then progesterone as a tablet called micronized progesterone. But there's lots of ways, and it depends on you, so you'll chat to your doctor about which option is best for you. But estrogen can be taken as a tablet, for example in the Angelique tablets, or it can be taken transdermal, so through the skin, either as a patch, a gel, or a spray. So those are the ways you can get the estrogen. And then the progesterone you can take as a tablet, or you can take it as the Mirena. So that's an intrauterine device, so it's a little T-shaped structure that we place into your womb, and that also protects your womb lining while you're on the estrogen. So just to recap, hormone therapy, menopausal hormone therapy, previously known as HRT, is a way that we treat menopausal hot flushes and night sweats and osteoporosis, and it has really good evidence to help with those conditions. If you are within 10 years of your last period and under the age of 60, the benefits generally outweigh the risks. There's different forms, but you'll have to make an individualized decision on that. And if you have a womb, you'll get an estrogen plus a progesterone. And if you have no womb, so you had a hysterectomy, you will just get estrogen. So look out for our next video, which explains the benefits and the risks of hormone therapy in menopause.